KwaZulu-Natal is known for many things: warm ocean, rich culture, abundant wildlife, but sadly the highest HIV/AIDS population in South Africa. But instead of giving in to this statistic, a group of occupational nurses decided to create a place of hope and care for HIV/AIDS patients who have nowhere to turn. Today, on the outskirts of Richards Bay, Ethembeni Care Centre continues to live up to its name as a place of hope, thanks to the long-term commitment of its staff and its founding partner, BHP Billiton. Let's meet some of these brave individuals and the nurses that help them to pull through. HIV/AIDS combined with TB has had a devastating effect in KwaZulu-Natal. 80% of victims are between the ages of 15 and 49, a time when they should be most economically productive. These diseases have a direct cost to the health services and an indirect cost to the family and community.
Ngikhule ngaphansi komndeni ohlangene, baba nomama bakhona bayaphila. Mina ngimdala ekhaya. Bengisiya nomsebenzi bengihlala ekhaya ukusiza umama engadini nasegcikeni kwase kungiqala ukugula.
Ekhaya kusemtuba. Shuthi ngikhulele khona nje kusukela ngimncane. Bengidlala ibhola kakhulu. Bengisebenza impela ngirenka. Futhi bekukuhle nje futhi kumnandi. So kwase kwenzeka khona lokho okwenzekayo ukuthi ngabanjwa lokugula okwangibamba.
Ngahamba ekliniki. Angithola ngosizo kwaze ukuba ngafika la ekhaya ke. Ngisizakale kakhulu ngoba ngafika la ngicabanga ukuthi kwakusela ama-minutes ukuthi ngishone.
Kule ngoDisemba ngaphathwa nje umkhuhlane hayi ngaze ngehla ngeza la ekhaya. Mangifika la ekhaya kwathiwa ekhaya angiye esibhedlela. Khona bezofika bengicheck ukuthi nginani bengigula bafike bangichecka ke bathi ngine-TB. Base bengithatha sebethi angizi la esibhedlela. Bengafika impela ngigula ngoba ngangazi ukuthi ngubani igama lami.
Ethembeni Care Centre was started in 1996 to combat KwaZulu-Natal's ever-increasing levels of HIV/AIDS. The hospitals were not coping, and with the escalating patient numbers, it fell to the dedicated team of nurses at Ethembeni Care Centre to ease the burden on families and government.
Shuthi saba nenhlanhla ukulethelwa yona ngoba ngiyibona umehluko ebhedlela ngiyibona mangifikile ngikhathi kusagula lo mfana. Bayakwaqoqa nomuntu njengoba kade ngisho kuqala. Abe umngani wabo baxoxe naye uzobe bembiza ukuthi babiza ingane yakhe ekhaya bekhuluma naye.
We are receiving patients all over from the northern KZN. To those patients that has been seen by the doctors and definite diagnosis has been made, and they cannot be transferred home or kept at the hospital because of bed shortages. They are then transferred here. We are talking about patients who are paralyzed, who are quadriplegic. We are talking about patients who cannot actually feed themselves, who cannot actually take care of themselves at home. We know that at home, most people at home are not trained to care for these patients.
The most important thing is to implement holistic nursing approach, where all the aspects of a human being are catered for. Physical aspect, emotional aspect, spiritual aspect, psychosocial aspect, which will involve many sectors. The care will be multidisciplinary.
Benginakekela ngokunikeza yonke into bengiyidinga namaphilisi ami benginikeza wona. Bengikhumbuza ngaso sonke isikhathi ukuthi ngiwasebenzise. Sengikwazile nokuvuka, ngakwazi nokuzama ukuhamba. Bangisize kakhulu la ekhaya.
Please stay tuned, because after the break we find out how corporate, government and NGO partnerships make sure that people like Lindiwe still have hope for the future.
Imagine a world where young minds are nurtured, where health is the greatest gift, and roads always lead you home. At BHP Billiton, we don't imagine, we do. BHP Billiton, resourcing the future.
Sinamukele futhi. Did you know that if detected in time and treated, TB is curable? And HIV can be treated just like any other chronic disease. Sufferers can still live a long and fulfilling life. Let's go back to Ethembeni Care Centre and find out how they give hope to their patients. Seeing how the nurses at Ethembeni care for the patients is really humbling. It takes strength and compassion to do what they do every single day. And just hearing how the centre has changed lives, not only of the patients, but the families and the community as well, you start to understand why Ethembeni is a place of hope for many.
Mina ngumama wakwambuyazi uVanessa, ngizela Ethembeni isibhedlela. Ngizobona umntanami ngogula kwakhe kwangena ngoJanuary. Ngangingenalo ulwazi ukuthi ngizomzisa kuyiphi indawo ukuze ethole lolu usizo athole lapha Ethembeni. Ngangithi mangithi ngiyabuka lapha esibhedlela engwelezane vele ethi ngathandi ngoba ukhona wasekhaya ulahlekile khona lapha yana. Abanasi unakekelo njengola lapha Ethembeni. Sizombona njalo senzele ukuthi enhlizweni yakhe kungabanakho lokhu ukuthi sesimtshingile esibhedlela ubuyagula. Ngaze ngaba nethemba ngempela ngelila ngafika lapha eqinile engajabula.
The war against rampant infectious disease needs many allies. The Ethembeni Care Centre was lucky enough to have partners in the Provincial Department of Health and in the mining giant BHP Billiton, which has operations in the area. Both sides bring valuable resources to the fight.
Ethembeni is established on the partnership, so we want to partner with whoever can bring a positive thing to our centre. A centre like this make it easy for the private sectors to implement whatever is in their hearts, because they don't just give money out, but they give money to people who are skilled, who are able to deliver and to do the proper job.
We've been established in this area since the early 70s, and in around about the early 2000s, we recognized the need to address the increasing prevalence rate in HIV and AIDS. Through partnerships with the Provincial Department of Health and the hospital in Golazan, it's been made possible that we don't have to fund the operational aspects, medical running of the centre. What we do is the upkeep of the building, upkeep of infrastructure, helping with maintenance, and that's made it sustainable. The HIV and AIDS impact on our community just around where we actually operate could have been a lot worse if we hadn't been able to sustainably support this centre.
Is it a fantasy for someone who was at death's door to have dreams for the future? For Lindiwe and Bongosi, it's all possible, thanks to the hard work of the staff at Ethembeni Care Centre and their partnership with BHP Billiton and the Provincial Department of Health.
Mina mangabe ngiphuma la into engifisa ukubuyela emuva ngiyosebenza njengoba ngempela ngisebenza vele. Qhubeke ngisebenze ngibone uma ngisebenza ngiqhubela phambili ukuthi uyokwenzakalani.
Ngiyazi ukuthi ngizogcina ngiphumile ngibuyele ekhaya ngoqhubeka ngisiza nomama.
Wow, this story is really a celebration of courage and strength. It is so hopeful to see how a simple collaboration between the private and public sector can change a community in so many ways. Having a sanctuary like this can change the way so many people view HIV/AIDS and its treatment. If you'd like to comment or discuss any of the issues raised here tonight, please join us on Facebook or on Twitter. Start a national dialogue and make your voice heard.